periodontal probing in health and disease. This animation will demonstrate the step-by-step process of periodontal probing in both healthy and diseased periodontal pockets. Position the patient comfortably and ensure proper lighting for visibility and access to the oral cavity. The periodontal probe is a great tool to quickly identify critical probing depths that can provide information on periodontal health or disease status of the patient. Gently insert the probe into the sulcus. Probe along the long axis of the tooth, extending towards the attachment level and not the sulcus wall, with typically around 20 to 25 grams, which is roughly equivalent to the weight of the probe itself. In healthy tissue, resistance is felt at a depth of 0 to 3 millimeters, as shown here. This is the anatomy of healthy gingiva, where the sulcus depth typically ranges between 0 to 3 millimeters, and there is no loss of attachment, highlighting the connective tissue attachment level at the CEJ and epithelial adhesion. In this example, probing depth of 2 to 3 millimeters, absence of inflammation, and no attachment loss signifies healthy periodontium. In plaque-induced gingivitis, we observe increased pocket depth, inflammation, bleeding, and loose epithelial attachment and connective tissue fibers, leading to penetration of the probe into loose connective tissue fibers. At this stage, no bone loss and attachment loss is present, and supracrustal connective tissue attachment is at the level of the CEJ. Therefore, with treatment, plaque-induced gingivitis is reversible to original health. In this example, probing depth of 4 to 5 millimeters, presence of inflammation, and no attachment loss signifies plaque-induced gingivitis. In periodontitis, we observe increased pocket depth, inflammation, bleeding, and loose epithelial attachment and connective tissue fibers, leading to the penetration of the probe into loose connective tissue fibers. At this stage, bone loss and attachment loss is present, and we may observe gingival recession, as supracrustal connective tissue attachment is apical to the CEJ, and there is apical migration of the epithelium more than 1 millimeter apical to the CEJ. After treatment and reduction of inflammation in periodontitis, we may not get the attachment level back to its original level. In this example, probing depth of greater than or equal to 6 millimeters, presence of inflammation, attachment loss, and bone loss signifies periodontitis. Measure the probing depth at 6 sites, including mesial buccal, mid-buccal, distal buccal, distal lingual, mid-lingual, mesial lingual of each tooth, by gently walking the probe from one position to next. Here, the probing depths are recorded as 323 from buccal and 334 from lingual. Ensure to record interproximal probing under the contact area to ensure accuracy, not at the line angle of the tooth. In deeper periodontal pockets, presence of hard biofilm or calculus can prevent the probe from reaching to the depth of the pocket, giving an under-measurement reading. This comparison highlights the differences in probing depth and tissue response between healthy and diseased periodontal conditions. Proper periodontal probing is essential for diagnosing and managing periodontal diseases effectively.